There are no known cases of the new variant in Canada, but public health experts say it's just a matter of time.
We'll be looking for it. And I don't think people should be surprised if we did get a detection.
The World Health Organization has named this latest variant detected in South Africa as Omicron, warning countries it is a variant of concern.
This variant has a large number of mutations, and some of these mutations have some worrying characteristics.
In other words, Omicron could be more infectious, could cause more severe illness, and could get around immune defenses. Scientists estimate the variant has 32 tiny mutations in its spike protein. That's a problem because previous infections and vaccines have shown our immune system a version of that spike. Mutations could make it harder for antibodies to recognize this variant and stick to it in order to block it from entering our cells.
However, it's early days. We need to get the virus in people's and scientists and research labs' hands to test to see if these doom and gloom predictions actually pan out.
Already, reports say a Canadian visiting Hong Kong is infected, possibly catching the variant from a South African traveler staying in the same quarantine hotel. It's not clear if either are sick.
We understand that people are concerned. The good thing is that we have monitoring systems around the world to detect these variants very quickly.
Using virus surveillance, scientists have now identified roughly 100 cases in countries worldwide, including Botswana, Belgium, and Israel.
You're seeing the world be very, very cautious right now and proactive in saying, we've identified something. We need to get ahead of this as much as we can.
Scientists insist public health measures still work and travel bans can slow this variant down. But as long as this virus is still circulating and people remain unvaccinated, new and potentially more dangerous variants remain a real risk. Christine Burak, CBC News, Toronto.
Well, infectious diseases specialist Dr. Isaac Bogosh is going to stay with us through our coverage of this new variant. And Dr. Bogosh, first of all, this sounds very alarming to a lot of people. From your perspective, how big a threat are we looking at?
I think we have to approach this with a degree of healthy respect and caution. The big questions are, to what extent is it more transmissible? Does it evade the immunity that we have from vaccination, and does it chip away at that protection from immunity or the immunity we get from recovery from infection? And does it cause more significant symptoms? I think the key thing here is it would be extremely unusual for a variant to emerge that completely erases the protection we have from vaccination. It might slowly chip away at it, but it's very unlikely that it completely erodes the immune protection that we have with 2 and even 3 doses of the vaccine.
All right, lots more questions to come, so please stand by.